So welcome everybody to this second day of the International Safe Cassava Network Symposium. It's really fantastic to have so many people from different countries and different languages to come together to pay attention to this important crop, cassava, and the diseases associated with its toxicity, especially conzo, and how to improve human health. This symposium is hosted by the Global Plant Council, and we have with us Isabel Mendoza, who's the Chief Communications Officer of the Global Plant Council. The Global Plant Council is an umbrella plant science organisation working to build a sense of community among plant scientists, dissemination of research and information, and working in policy. And I'm sure they would enjoy to have more societies join from different parts of the world. Currently, some underrepresentation from Africa. So if you're an African plant scientist, please get in touch with Isabel or send her a message in the chat about that. My name's Gleadow, and I'm a plant scientist from Monash University in Melbourne, Australia, and I study crops that make cyanide, including cassava. And as I started doing this, I realised there were these huge human elements, and connected with Julie Cliff and many other scientists, including many of the speakers from Mozambique, people who are going to talk this morning. With me also this morning is Kira Ma, who, if you've registered, you may have heard from. She's providing administrative support. I'd also like to thank members of the Safe Cassava Working Group who have organised this symposium. This is a small group, an ad hoc group of people working in cassava and conzo from around the world. And it has grown out of the Cyanide in Cassava Diseases Network that was originally set up by Howard Bradbury. Feel free, a few administrative things, a bit of housekeeping. Feel free to use the chat, talk among yourselves, but you must use the Q&A function at the bottom of your screen to be able to ask a question to be answered by the speaker. There is an option to display closed captions in different languages in real time or slightly delayed time. We will need this because not all our speakers present in English, and this is part of recognising the importance of cassava in different parts of the world, that we shouldn't just be limited to the English-speaking dominance of science. So if you want to enable these captions, if you go to where it says CC or closed captions, there's an up arrow. You need to enable translation and then select the language that you want to read it in. And then there's options for how you want to display that or the transcripts. Now, if this doesn't work, or if you're listening to the recording of this at a later time, because this is being recorded and will be up on YouTube, it's also been live streamed on YouTube. But if you watch the recording on YouTube, there are other instant translation options there that are probably better than the ones that we're dealing with here in Zoom. So we really want to do this. Kira will post the instructions for this in the chat. Now, you are not here to listen to me, you are here to listen to the experts. And now I would like to pass on to our chair for this session on public health, Professor Humberto. Can you take the floor, please?
Thank you so much, Professor Ross. My name is Humberto Muquingue. I'm a professor at the medical school at Eduardo University in Mozambique. I've been working on conzo for the past 30 plus years, and my mentor has been Professor Julie Cliff. In today's session, following an amazing night day, we'll be focusing on public health. And for this session, we'll be bringing the perspective of Mozambique, where among so many priorities, conzo is still to get the proper place in terms of public health. So for this session, we'll be having 3 speakers. The first one will be Dr. Dulce Nhassisco, who will be talking about public health and nutrition in terms of CONSO, Mozambique's gaps, global attention, and paths forward. Dr. Dulce Nhassisco is a Mozambican and a medical doctor with a Master of International Public Health and Nutrition from the University of Queensland in Australia. She's a lecturer at the Faculty of Medicine at Eduardo University, Mozambique, where she has been teaching and conducting research in nutrition and biochemistry for nearly 2 decades. Beyond academia, Dr. Nhassisco has extensive experience in nutrition programming with USAID and UN agencies, bridging scientific evidence with public health action. She's also a former lead of maternal and child health and family planning at USAID Mozambique, where she managed a large portfolio and worked closely with government and development partners on maternal and child health and nutrition. So, Dr. Nhassisco, the floor is yours. Please go ahead. Welcome.
Thank you so much, Dr. Humberto. Let me start by sharing my presentation. Thank you. So, good morning, good evening, everyone. As Dr. Humberto mentioned, my name is Dulce Nhassisco from Mozambique. I will be talking about public health and nutrition in times of CONSO. But first of all, let me thank the organizers for organizing this great event and also for the opportunity to be presenting and talk about CONSO. So CONSO is a neglected public health and nutrition problem that actually reflects the intersection of malnutrition, poverty, and food insecurity. So my presentation will highlight challenges, silences, and opportunities for action to address CONSO in Mozambique. So what is the purpose of this presentation? This presentation aims to present CONSO as a neglected public health and nutrition issue in Mozambique. Also highlight the structural and nutritional factors that sustain it, including chronic food insecurity and also reliance on bitter cassava. I will also touch on advocacy for integration of CONSO into national policies and also in donor investments to prevent recurring outbreaks. So this is the outline or the roadmap of my presentation. It will move from understanding CONSO to conclusion and call to action. I will also quickly talk about CONSO outbreaks in Mozambique, and also to take the opportunity to mention that the data that we have is the best that we could get, because that's unfortunate that CONSO has been underreporting in Mozambique. So we may see some data that's still not accurate. We also talk about determinants and nutrition context, actions and opportunities. Some lessons from the field will also be shared. I will also touch in institutional and global neglect, as well as the strategic way forward. What can we do to improve the situation in Mozambique? So, to understand CONSO, yesterday we had very good presentations where CONSO information related to the disease was provided. So I will not go deep in terms of explaining the medical condition as such, but it's important to mention that CONSO is an irreversible, non-progressive spastic paralysis caused by chronic exposure to cyanides from bitter cassava. It affects mainly women and children in poor and food insecure rural areas. It also, I had mentioned that previously, it exposes the intersection of cyanide exposure, malnutrition, and poverty. So we can consider a Konzo as a symbol of hidden hunger and structural inequality. And in that way, we can mention also that the Konzo is the visible face of invisible hunger. So, to touch on some epidemiology, historical epidemiology in Mozambique, to mention that the first officially reported epidemic in Mozambique happened in 1981, where over 1,100 cases were identified in Nampula province and traced back to earlier 1917 cases and peaking during severe drought. So the first official epidemic was reported by the government in 1981 in Nampula province. Most of the focus of that presentation will be on in Nampula, since it's the epicenter or is the province that is most affected by Konzo in Mozambique. In 1980s, we had smaller outbreaks that we couldn't document because the reporting was incomplete due to war. Back in 1992 to 1993, we had another large epidemic with more than 600 cases, also in Nampula province, and it was more related to war situation. We had a lot of displaced people in situation of food insecurity. So in that context, we had an additional outbreak. Over the time, we also started to see Konzo expanding to other geographic areas, such as in Zambezia province, where we saw the first outbreak in 2000 and 2005. It was caused by drought and also food shortage. In this case, it was not related to war, but we had severe drought and also food shortage in this province. After almost 15 years, as you can see from 2005 to 2020, we had another epidemic in the same province, in Zambezia province. So that situation highlights the deterioration in socio-economic situation, meaning that after 15 years, Mozambique still facing the same challenges in terms of food insecurity. And we started also to see the epidemic expanding to other geographic areas. After that, that's unfortunate because we're still seeing some sporadic cases in the same provinces, Nampula and Zambezia. So we've been doing some actions, mainly in these two provinces, but for this presentation, as I mentioned, we'll be more focused on Nampula province. So, looking to some determinants and also the nutrition context in Mozambique, what can we say about that? First of all, I think that most of us know that one of the determinants of Konzo is the low protein intake that limits detoxification of cassava cyanide, meaning that if the population does not have a variety of food, they will not be able to get proteins, and not getting proteins, their ability to detoxify from cyanides is very reduced. So it also poses risk of conzo, and it's also associated to other factors such as underlying malnutrition. Most of population in Mozambique have malnutrition, mainly chronic malnutrition, and all these factors also increase the risks for conzo. We can see some micronutrient deficiencies that are very common in Mozambique, such as the iodine or lack of iodine and also lack of selenium. Besides that, we also have some environmental situations that increases even further the risk of conzo in Mozambique. Mozambique has been facing several natural disasters caused by cyclones. In these last 10 years, we had several cyclones, and the provinces that are the poorest one and with poor nutrition indicators are the most affected or most impacted by these cyclones. We also have droughts and also poverty. And all of that together worsen the food insecurity. And by doing so, it makes people rely on bitter cassava. That is the only food that is available in their communities. Gender also is a risk factor. We did realize that most of the cases of conzo are seen in women, girls, and children, because women and girls are the ones that go to the fields. They are the ones that process cassava. And by processing cassava, they are more exposure to cyanides, because during the process, they eat cassava, the fresh cassava that's very, very rich in cyanide because was not yet processed. So in terms of some nutrition situation or context in Mozambique, for example, I am talking about Nampula province. In Nampula province, that is the center of conzo, we have 45% of children under 5 being stunted. Also, a survey that was conducted showed that only 41% of the households consume iodized salts. So this factor also increased the risk for conzo. In some areas of Nampula, fewer than 10% of children meet the minimal acceptable diet. And most of the households, 18% of the households are in food crisis, and most of them have less than 3 months of food stocks. And I also mentioned the high dependence on bitter cassava. So since the epidemic started, what actions we have done in Mozambique, and which opportunities we think that can be used also to minimize the situation? Starting from the community level, we maybe first of all mention that most of these small efforts that were done in Mozambique were relying on funding, not from the government, but funding from partners. And so the government doesn't have a structure that provides funds to support conzo interventions. So the small interventions that we've done in Mozambique were relying on funds from external partners that we had at the time, because right now we are also facing some challenges to get funds to keep the work on conzo. So what we did with the funds that we had, at community level, we did conduct some sensitization campaigns on the importance of good nutrition, good diet, and processing methods. We also trained some communities on safer cassava processing, and one of the methods that was brought to the community was the wetting method. Yesterday, we did talk about this wetting method. So in Mozambique, also, we did implement or we did test that method in some of affected communities. We also supported small-scale rehabilitation interventions, also at community level. At institutional level, at that time, we create a cassava multi-sectoral working group that was composed by the Minister of Health, Minister of Agriculture, and also the academia. So we had this multitask group that was working on Konzo and cassava-related issues. We also train a small number of health providers, mainly in Zambezia province, to test cyanides in cassava flour and also in urine. We also have these two, the last two are the government frameworks or government programs. We have the first one, that is the PAMERDC. That one is from the Minister of Agriculture. And also we have some programs from the Ministry of Health. To mention that these two platforms were not created in response to Konzo, but I see them as an opportunity to prevent Konzo, because the first one is linked to agriculture. It has a multi-sectoral approach. It tackles food insecurity, and I think that these ones are good platforms for preventing Konzo in Mozambique. So from the actions that were undertaken at that time, I will talk more about rehabilitation at community level. And the first slide shows the achievements that we managed to get through the program or the project that was implemented in Nampula province. For example, in this case, the teams from Nampula conducted field visits to identify and support patients with motor disabilities. 391 patients were identified. From them, 84% were related to Konzo. And from that group, 355 received some mobility aids, and 73% of them received locally produced assistive devices. So besides that, plans also were made to establish community-based rehabilitation centers. So that's what we did in terms of rehabilitation of cases at community level. On my right, there is a graph that shows a distribution of assistive devices that were provided to the patients from 2015 to 2018. We can see in that graph different devices, and most of them were locally produced, meaning that we don't need much money or a lot of money to minimize the impact of Konzo. With local materials, we can be able to produce some of the materials that will minimize the impact of the disease. You can see that throughout 2015 to 2018, the distribution was not regular, meaning that the supply was very irregular, and we reached the peak in 2018, but that activity stopped exactly in 2018. Up to now, we are not doing any type of rehabilitation services at community level. In terms of gaps, what are the gaps that we have? From the group of patients that were identified, 95% were not, 95 patients were not able to get mobility aids. And also to mention that the number that I show represent some of the communities in Nampula province, but we have Konzo in other places in Mozambique, mainly in Zambezia, and the numbers are even higher than what I'm showing in the presentation. This is a small sample from Nampula province, where the project of rehabilitation was implemented. Another challenge that we faced is that there is a limited rehabilitation infrastructure. The planned centers are not operational, still not functional. Also, another gap is that children, or there is a low school attendance among children with disabilities. From the group that was identified that corresponded to 73 children, only 4 are able to go to school because they are not able to walk. And another gap that we identified is that there is a need for sustained funding to continue device production and the field follow-up. The last challenge that I want to refer is the lack of integration of nutrition and the physiotherapy teams in district health planning. And this situation puts limits on an holistic rehabilitation process. So in that picture, that was taken by Professor Julie Cliff. It shows a community area where people were there for a rehabilitation process. And you can see that the local materials were used to support these communities. What are the lessons that we get from the work that we conducted in the field? Food diversification, nutrition education, and safe processing as strategic entry points to prevent consumption. Local knowledge on safe cassava processing exists at community level. What is missing is the government or is the structural support for these communities to scale up the interventions. Also, we believe that there is a potential synergies with the ongoing nutrition and the resilience programs in Mozambique. In these two provinces, Nampula and Zambezia, we have a lot of nutrition, not a lot, but some number of resilience and nutrition programs that we believe that they can be leveraged to also include the console issues. But that's unfortunate, it's not happening. So, moving to institutional and global neglect at the national level. There is absence of, let me say it other way. CONZO is absent from major nutrition and food security policies. So CONZO is not part of these policies at the national level. There is also a weak intersectoral coordination. I mean, academia, because academia is the one that conducts research, the Ministry of Health, the Ministry of Education, because we saw that there is high level of there is high number of children that are not able to go to schools, but also there is the Ministry of Health should be part of that intersectoral coordination. Underreporting and the lack of diagnostic capacity. That's another neglect. In Mozambique, we are not reporting cases. The lab is not able to confirm the levels of cyanides. Globally, little mention in global, or CONSO is not being mentioned in these global agendas. We have the scale-up nutrition, we have the GAIN, we have the GFF. In these global platforms, they support nutrition, they support food security, but there is no mention on CONSO. So that's a weakness, and we hope that in the near future, we can be able to see CONSO being more prioritized in these global priorities. Also, there is a minimal donor investment and funding for research. So what should be the way forward? The way forward can be at multiple levels. There are some that immediate, medium term, long term, and global level. Immediate, what can we do to minimize the situation? First of all, promote food diversification, nutrition education, and processing safety. Because when we went to Nampula, we proved that using the wetting method is enough or reduces significantly the levels of cyanides. Also scaling the wetting method, for example. Medium term, it's important to institutionalize surveillance of cases and cassava toxicity. We don't have this disease in national surveillance systems. It's important to integrate CONSO in health and nutrition surveillance and into national strategies. We have several strategies for food security, for nutrition, for health overall, but CONSO is not part of that. Also creates an interministerial task force. Long-term, support research and regional learning alliances. Globally, include CONSO in WHO, in Food and Agriculture Organization, from UN, in SADC platforms. Recognize CONSO as a neglected nutritional disorder. Frame CONSO as a sentinel disease of inequality, and also mobilize funding. So this is the way forward that that can be used to guide the interventions or all the aspects to prevent CONSO. In conclusion, and also call to action, CONSO is preventable but persists through neglect. It reflects poverty, food insecurity, and weak systems. There are several countries around the world that consume high quantities of cassava, but they don't develop CONSO. So meaning that CONSO is linked to poverty. Mozambique can act through existing nutrition and agriculture or resilience programs. Global community must invest and acknowledge CONSO as a neglected nutritional disorder. And finally, preventing CONSO is equal to advancing equity and human dignity. So that's all I had to share about Mozambique. And this is my closing sentence. CONSO is a silent disease because it affects invisible people. Thank you. Over to you, Dr. Professor Humberto.
Thank you very much, Dr. Dulce, for the wonderful presentation and the powerful call to action. I believe we all took note of your messages. And also thank you for keeping the time proper. We still have 10 minutes to spare, so that was a really short, concise, and very powerful presentation. Just a reminder, if you do have questions, please click on the Q&A button at the bottom of your Zoom screen to place your question to the presenters. So we'll be moving forward to the second presentation that will be done in Portuguese by Dr. Adelaide. So in order to be able to fully enjoy this presentation, we ask you to use the translation capability of your Zoom platform. Just click the CC button, and from there you can, oh, there it is. Kira just post instructions to allow you to enjoy the presentation that will be following. So thank you again, Dr. Nhassisco. Dr. Adelaide, are you in, please? Could you please share your presentation?
Boa noite.
Yes, while she's doing that, I just have to share with you that Adelaide is a researcher and head of the biochemistry section at the Faculty of Medicine, Eduardo University in Mozambique. She has a background in chemistry and biology and a master in adult education sciences. Since 2012, she has actively contributing to multiple studies on chronic surgeon exposure, morbidity management, and disability prevention related to Konzo, leprosy, and lymphatic filarias. Actually, she has done that work with our next speaker, Dr. Litos Raimundo. Adelaide also served as both as a principal and co-investigator in project assessing cyanide poisoning levels in rural communities in northern Mozambique. The title of our talk will be Laboratory Capacity for Konzo Diagnosis in Mozambique, the case of Nampula. So we are ready to listen to your presentation. Dr. Adelaide, please go ahead. Doutora Adelaide, pode começar, por favor?
Boa noite, obrigada. Boa noite, boa tarde. Muito obrigada pela oportunidade. Meu nome é Adelaide Cumbane, sou investigadora na Universidade Eduardo Mondlane, Faculdade de Medicina. E gostaria primeiro de agradecer pela oportunidade de participar nessa Conferência Internacional da Mandioca, falando concretamente dos casos da capacidade laboratorial para o diagnóstico do Konzo em Moçambique, e um caso particular da província de Nampula, que é uma província que está localizada no centro de Moçambique, que nos últimos anos tem mostrado elevados índices de prevalência do Konzo. Daí que vemos a necessidade de falarmos do Konzo, tratando-se de uma doença que é causada pelo consumo da mandioca amarga ou mal processada, que muitas das vezes apoquentam as pessoas de baixa renda, ou seja, as pessoas pobres desfavorecidas do centro e norte do país, principalmente as províncias de Nampula, Zambésia e Cabo Delgado. Indo concretamente para o tema que vamos apresentar sobre os laboratórios, tenho aqui a estruturação da apresentação, que vai ser primeiro os objetivos desta apresentação, depois vamos à contextualização e a justificação da necessidade de laboratório no centro do país. E teremos alguns pontos de partida para encontrar soluções locais de Moçambique e idealizando soluções também internacionais. Em relação aos objetivos desta apresentação, temos aqui como um dos primeiros objetivos justificar a necessidade da capacidade laboratorial para o CONS em Moçambique, descrever a situação laboratorial das unidades sanitárias na maior parte ou maior incidência no país e propor algumas soluções a nível local e a nível internacional. É importante aqui contextualizar a situação de Moçambique, que nós, né, concretamente, temos o pessoal existente técnico laboratório é um número considerável, na sua maior parte, e com um nível de educação sanitária, a educação secundária, o nível médio, concretamente, que estes mesmos profissionais estão distribuídos em diferentes unidades sanitárias, desde o primário até as zonas rurais, e que desempenham várias funções ou vários papéis, desde a coleta e conservação das amostras para diferentes doenças endêmicas, a preparação de procedimentos, análise das amostras, gestão de resíduos biológicos e, é importante também, neste momento da contextualização, secundar que estes profissionais técnicos de laboratório são formados, na sua maioria, em instituições de ensino técnico profissional. Eles possuem conhecimento básico e adequado para lidar com várias componentes laboratoriais. Daí que surge a necessidade de prestar muita atenção a este grupo. Temos aqui, de seguida, a justificação da necessidade dos laboratórios. É sabido que temos algum diagnóstico clínico em relação à doença do Konzo, desde o historial que os pacientes apresentam, os sintomas, os clonos que sejam reconhecidos e que sejam precisos, mas os laboratórios têm um papel ainda cada vez mais crucial aqui em Moçambique, porque a partir da componente laboratorial nós podemos conduzir as análises necessárias dentro de um ambiente seguro, um ambiente controlado e seguro para a conservação dos próprios reagentes. Temos um exemplo para o caso, concretamente, das análises para o cianeto e tiacenatos. Nós precisamos de conservar os kits onde contém um papel picrato no meio de frio, então, para conservação e armazenamento das próprias amostras também, desde as urinas, etc. Então, tem que haver também o descarte seguro dos resíduos biológicos, as urinas e o sangue, etc., depois de terem sido processadas essas amostras. Tem que haver garantia de segurança nesses aspectos todos para haver um resultado benéfico. Então, notamos que quanto mais periféricos e próximos estiverem os resíduos, então temos que ter essa garantia de existência de laboratórios periféricos e mais próximos das unidades sanitárias, com maior importância dada à componente laboratorial. Aqui é preciso salutar que em Moçambique, precisamente no centro e norte do país, tem-se verificado o maior índice de surtos do conzo, e que é em determinadas épocas do ano que temos tido essas situações. Daí que é muito imperioso que haja laboratórios bem equipados e preparados para responder à grande demanda e busca de serviços nessa época do ano em que aparece eh, eh, essa, como é que eu posso dizer, quando aparece o agravamento ou muitos casos do CONS. Dando continuidade, agora tínhamos que analisar, mas qual é a situação laboratorial, concretamente na província de Nampula, onde é a província que temos o foco para o dia de hoje. Nampula, como já havíamos dito antes, que é a província com maiores números de casos de conzo, e fez-se agora um levantamento para vermos em que nível de números de laboratório existem lá, principalmente nos distritos onde se verifica maior índice de casos, e vimos que existem por aí 240 unidades sanitárias dentro da província de Nampula, e nessa província há 18 laboratórios em 34 unidades sanitárias urbanas. Isso corresponde a cerca de 53%. E que temos também já nas unidades sanitárias rurais cerca de 46 laboratórios. Temos 206 unidades sanitárias rurais que correspondem e que só temos dentro desse universo 46 laboratórios. E tratando-se de conzo, que é uma enfermidade rural, é preocupante a situação que é nos apresentada aqui na província de Nampula. E torna-se muito crítica, tratando-se de uma província que a cada dia, a cada ano, o cenário é outro, em diferentes distritos, principalmente nos 7 distritos que aqui referenciamos ou vamos referenciar logo a seguir, que é Muquingue, Memba, Liopo, Herati, Nakaroa, Murupula e Muecate, que tem em média apenas 2 laboratórios em cada um desses distritos. Embora que o número das unidades varia de 5, por exemplo, em Liopo temos 5 unidades sanitárias, em Memba temos 3 unidades sanitárias. Só que em Memba a situação torna-se mais agravante, porque nessas 3 unidades sanitárias só nos apresentam apenas 3 laboratórios, o que se torna difícil fazer-se a medição ou o diagnóstico dos casos do conzo em forma laboratorial. Quando a esses distritos temos Memba como centro, o epicentro desses casos. Entretanto, temos um cenário que é é um cenário que deixa muito a desejar. Aqui, a seguir, temos a ilustração de umas técnicas de laboratório que estão na sua atividade diária e neste momento estão a fazer a medição das concentrações da urina em cianetos. Era um método que nós usávamos em muitas zonas rurais e urbanas para o diagnóstico de cianitos e de tiacenatos na urina. Na altura tínhamos um apoio que era dado dos kits, onde tínhamos o kit de ácido pícrico para a medição. Nesses últimos anos já não temos tido esse benefício de sermos financiados, o que nos deixa uma lacuna, a falta desses kits para a confirmação laboratorial, porque eram kits que nos ajudavam bastante no diagnóstico da doença. Agora, a pergunta que não quero calar é o que estes achados nos dizem perante esse cenário todo, que é a falta de investimento em equipamento e infraestruturas. O diagnóstico do câncer exige não apenas o conhecimento clínico e epidemiológico, mas também o laboratorial, para poder ajudar a identificar os marcadores bioquímicos, tais como os níveis de cianetos. Há discrepância, sim, na disponibilidade de recursos humanos e a falta de equipamento, que são os kits que há pouco me referi. Então, isso cria uma certa situação paradoxal, porque temos, na verdade, o privilégio de termos pessoas, os técnicos formados, ou que tenham algum conhecimento básico, mas que sem nenhuma ferramenta plena para executar diferentes tipos de análises clínicas que sejam necessárias no devido momento, em casos de surto. Então, a confiabilidade de baixa de diagnóstico clínico, em geral, sim, não se trata, afinal de contas, em muitos casos, porque quando pode ser diagnosticado um caso clinicamente, a pensar-se que é o câncer, mas se tivéssemos também a possibilidade de fazermos diagnóstico laboratorial, seria muito útil para depois podermos conciliar as duas vertentes. Outro ponto de partida seriam as necessidades de investimento laboratorial perante essa situação crítica que vimos que urge a necessidade de haver um investimento laboratorial em Nampula, concretamente, enquanto não houver um investimento consistente em tecnologia laboratorial, continuaremos a enfrentar sérias limitações para diagnosticar o câncer de uma forma precoce, sistemática, precisa e em larga escala. Então, há que haver um investimento. O investimento não precisa de ser em grande escala ou massivo em todos os níveis de serviço de saúde, mas pelo menos em sítios ou locais estratégicos, desde as localidades, por exemplo, que nós conhecemos, um dos exemplos peculiares é Memba, onde encontramos 3 localidades de grande vulto, que é Cavá, a Cores do Lusaka e Mujocódio, com crianças ainda na fase escolar que apresentam o câncer nessa idade, e mulheres também em idade fértil. Então, tinha que se ver a necessidade de haver um grande investimento, criar-se laboratórios de referência, principalmente para essas localidades de Memba, bem equipados para apoiar também as outras unidades periféricas, uma vez que só em Memba temos três unidades sanitárias. Então, que iria isso tudo ajudar tanto no transporte, tanto na conservação das amostras. Quais seriam as soluções locais para Moçambique neste momento perante essa situação sombria que estamos a apresentar? É que o nosso Ministério da Saúde tinha que se buscar um papel mais ativo dentro do Ministério da Saúde para ver se com os parceiros pode se fortalecer a existência de laboratórios distritais, e, quiçá, mesmo laboratórios nas localidades, equipando alguns com medições simples, termos algum material de baixo custo e fácil de se usar para a detecção. E temos também a possibilidade de, junto ao Ministério de Saúde, talvez agregar a componente contínua de formação dos técnicos, porque nós conseguimos notar que nessa nossa busca, nesse nosso levantamento, existem sim unidades sanitárias periféricas, do nível primário ao nível desde rural, tipo 1, tipo 2, também unidades sanitárias urbanas A, B e C, do nível A, B e C, mas tentamos, encontramos uma situação que deixa muito também além das nossas expectativas, que a maior parte dos técnicos que lá existem não tem formação nessa componente do CONSO, de diagnosticar ou de fazer as medições do CONSO, que é uma técnica que usa métodos muito simples. Então, urge a necessidade de termos programas de educação contínua, de aprendizagem, para apoiar esses locais em tecnologias fáceis de manuseio de novas tecnologias. A integração também podíamos incluir o rastreio laboratorial de programas de saúde da comunidade para reduzir esses casos do CONS. Temos aqui também soluções de apoio internacional. Aqui estamos a pensar se numa parceria entre as unidades locais e estrangeiras. Aqui, por exemplo...
Adelaide,
sim.
Adelaide, tem mais 2 minutos, por favor.
Quantos?
Tem mais 2 minutos, por favor. You only have 2 more minutes.
Sim. Então, aqui em parcerias com universidades locais, temos, por exemplo, a Universidade do Unilúrio, que se prontificou em criar um espaço para, caso haja algum financiamento, podíamos colocar lá um laboratório para esse tipo de investigações. A colaboração também é importante com a OMS e outros parceiros como a FAO e a Unicef, integrar na vigilância do CONSO e na monitoria dessas doenças negligenciadas. E criarmos um certo modelo de laboratórios de referência para o bem das populações. Concluindo, pode-se dizer que a Moçambique está centrada, tem uma oportunidade clara centrada no aproveitamento da força de trabalho já existente nos laboratórios, no manuseio de melhores condições técnicas para que possa responder às doenças negligenciadas, na criação de uma base robusta de evidências, que não depende exclusivamente do diagnóstico clínico, mas sim da possibilidade de detecção precoce e monitoria monitoria e pesquisa científica sobre o CONS. Na exploração, de colaborações regionais e internacionais para consolidar o combate contra o câncer e fortalecer os sistemas diagnósticos. E muito obrigada pela atenção dispensada e dou-me por terminada a minha apresentação nessa conferência. Muito obrigada.
Muito obrigado, doutora Adelaide, por esta magnífica apresentação. Pensamos que a sua mensagem passou. Vou passar a falar em inglês para os outros perceberem. Thank you, Dr. Adelaide, for this very calm and very closed and interesting presentation on how to improve diagnostic capacity in Mozambique on behalf of better cause diagnosis, especially if it's intended to be early and systematic. Again, for the ones who just joined, please, for your questions and answers, click the button at the bottom of your Zoom screen and place there your question. We do have about 5 questions for the presenters, but let me just acknowledge the next speaker, Dr. Raimundo, and then at the end we'll be covering all the questions that you have. Our next speaker will be Dr. Litos Raimundo, also from Mozambique. Raimundo is an expert in environmental management and agricultural development, and is currently serving as country director for Agra Mozambique, that's a agribusiness organization in the country. Before he was the country director for the Netherlands Leprosy Relief, where he managed agricultural, health, and social development initiatives focusing on agribusiness, neglected tropical diseases, and climate-smart agriculture. His background includes a master in environmental management from the University of Derby, England, and an MBA from Regent Business School, also from UK. He's currently pursuing a PhD in ecology and environmental health at Fernando Pessoa University, Portugal. Dr. Raimundo, the floor is yours. Thank you.
Thank you, Professor Muquingue. I'll try to show my presentation. So I want to thank the organizers of this event for giving me the opportunity to make this presentation. As Professor Muquingue said, my name is Litos Raimundo. I'm a PhD student. I'm looking at social perceptions of Konzo. And I've been working on Konzo in the last 8 years. I have been actively engaged in addressing Konzo-related challenges, especially in the semi-provinces that have been mentioned here, Zambezia, Nampula, mostly in public health issues, but lately more as advocate for institutionalizations of the surveillance itself. This presentation, I'll be looking at Konzo. I think I will run through these two presentations, two slides, because there was a detailed explanation of technical explanation of what Konzo is yesterday by Professor Desiree and Professor Esperanza, and also today by Professor Nhassisco. And the science behind Konzo, historical outbreaks in Mozambique that has been also outlined with Professor Nhassisco. I'll explain the bit of the social reality, social and economic reality of member district, and why Mozambique must act now to prevent the next outbreak, and the proven. I will also talk about the proven strategies to prevent it, barriers, and some recommendations. Well, this is what Konzo is, and there is a lot of literature explaining that. As I said yesterday, there was a detailed explanation of what technical Konzo is, most as neurotoxic disease causing sudden irreversible paralysis of the legs, and it's triggered by cyanide exposure, mostly affecting vulnerable people who are water and food insecure, as explained yesterday. and the science, the biochemistry of risk of Konzo. The picture here illustrates the linkage between the Australian and also that cyanide intoxication that blocks cellular respirations, leading to motor neuron damage. Also emphasizing the malnutrition, especially the lower sulfur amino acids, which increases susceptibility of the risk. Historical outbreaks also have been outlined by Professor Nhassisco, starting from 1981. Through the last studies that I have access are done by Professor Mloliwa in 2020, 2021, mostly in Nampula as well. We have been also collecting some non-published cases of Konzo in Zambezia and Nampula until 2022, 2023, but it's just at project level when I was working with NLR. So we are seeing here that since 1981 until 2021 or 2023, the latest result that we have, there have been cases. But which means that even today, if we go look for it, we shall find cases that are there that are not documented, that are constantly coming up, especially in this province of Nampula and Zambezia. Now, on member district as a case study, what we see that the case of member is the same one as most of the districts in the coastal area of the province of Nampula and the coastal areas of the province of Zambezia. And we see that typically it has lower precipitation, and the temperatures the average temperature is 26, it goes up to 43 degrees, and the soil is mostly sandy, making agricultural vulnerable to reduced rainfed, and good cassava producing areas, and because it's stress resistant and cassava, and people consume more cassava. And mostly Member is a poor community with poor road infrastructure, poor access to other areas. And since 1981, Member has been recurrent in having cases because it's having the same determinants that were mentioned here that were found in 1981, we can even find even today the same determinant: poverty, socioeconomic situations that are difficult, including the armed conflicts that are happening in northern Mozambique that are affecting this district, and the drought, and even this October, there are some cholera outbreaks and drought that have been reported, which means that the districts and the locations are still struggling with the same socioeconomic, even cultural situations that were happening in 1981 and along the years that the outbreaks have been coming. And why Mozambique must act now is that Member and other districts, and most of Mozambique, they are heavy, as I said, the same situations that were reported when the first outbreaks came. The social situation improved very little, but we are adding more to the the climate disasters and the climate change that is also affecting the country. There are more and more weather events that are becoming that are increasingly frequent and intense, especially the cyclones, floods, droughts, with an impact on agriculture and rural population. And more than 77% of the Mozambican population livelihood practice agriculture, and the agriculture is rain-fed, and the rain is more erratic right now. Cassava, especially the northern part of Mozambique, is consumed by It constitutes more than 8% of the production in this area, thus constituting the most dominant diet of poor families. It's a food security fallback, especially in cases when the extreme weather events happen. And sporadic cases continue to happen, though not documented as they were doing before, as mentioned, because of financial conditions and also less investments by donors addressing this situation. And the other thing is that there's no formal surveillance mechanism in place, especially in local health units addressing Konzo itself. If we look at the forecast of the temperatures, we see that the modeling by 2100, they are saying that right now, Member is a district that we see the average temperatures are around 24 degrees, but the forecast and the modeling is predicting to go as high as 32 average temperatures, and the precipitation will remain stable but dropping. Right now with 75 millimeters of rainfall, remember, to drop up to 500 up to 2100 the year 2100, which means that in terms of temperatures, the situation can get slightly worse than what we have now, and there is a need of acting now in order to address these situations. There are proven methods in order to minimize the situation. As mentioned before by Professor Nhassisco, there are some interventions that have been carried out. This is a study by Professor Nhassisco as well, where only with the weighting method, there were reductions in some communities until 0% of children are affected, though the sustainability, as mentioned yesterday, of the weighting method in the long term is questionable, which means bringing in other nutritional aspects is important in order to ensure that people, especially food security issue, in order to ensure that people fight the outbreaks. What's lacking? What's lacking has also been mentioned. I'm just adding some, especially the government leadership and policy integration. I think that should be the first thing that happen. The Ministry of Health should really assume that this is a disease. I think after Congo, Mozambique is one of the most reported countries. So which means that the Ministry of Health should take it seriously and also institute to have Konzo formally included in nutrition, safeguarding, and food security policies. The second one is surveillance and early warning system. There's no routine monitoring of cyanide levels in cassava flour or urinary thiocyanate in children, and lack of integration with existing health surveillance platforms. There is surveillance for malaria and nutrition tracking, but there's no Konzo included, as also mentioned by the previous presenters. There is absence of district-level reporting mechanism to detect early signs of Konzo outbreaks. Those which are reported sometimes are mistaken with other ailments, special polio and other diseases. The community level awareness and behavior change sensitization there is low adoption of the weighting methods, especially in villages like Kava, where it was under 10% the adoption of it. As I said, the method is not so sustainable. People tire implementing it, especially in times of stress, and weak extension services and lack of farmer training on safe processing techniques, and poor market incentives for safe cassava, no labeling of premium price for detoxified flour. So all these things are not, the awareness level is not yet there, that the simple awareness could really reduce the people who are affected by the disease. What to do? Also, most of the suggestions have been given. But I suggest also integrating the waste method into schools and community programs, because these are simple methods and cheap methods, just sensitizing the community, special children in their school age. Also, it was mentioned that supporting the research institutions, especially the agricultural research institutions, and also health institutes, and promotion of low cyanide cassava varieties, as well as other nutrient dense seeds that will help the people. And also link Congo prevention to nutrition, safeguarding, and climate resilience. Here should be a dialogue and engagement between the Minister of Health and the Minister of Agriculture, and also advocate for policy integration and emergency preparedness, also health and agricultural officials. I think this is what I had to present today, and mostly trying to show the agents of policy integration and also of government assuming that Konzo is a public health problem and should be addressed starting from the policy level. I want to acknowledge here my supervisors, also Professor Elsa Maria Salvador, who has been also working with me on a systematic review of Konzo in last year for this presentation. Thank you very much. Konzo is preventable. Let us act before the next crisis and protect the communities. Thank you. Over to you, Professor Muquingue.
Thank you very much, Dr. Litos. This presentation is also a call to action. It's the end of our session number 3 on public health with the Dulce, Nhassisco, Adelaide, Cumbane, and Litos, Raimundo. And it is clear that there is some sort of desperation from the side of the academia and also research audience in Mozambique regarding the need to act now in order to prevent Konzo, not just now, but also in the upcoming future. Just the opportunity for the ones that placed questions in the Q&A. I see that Dr. Dulce has already answered some of them, but let's review quickly what we do have here. It seems that a common line among the questions that are here is, why is it, for instance, in Nigeria, people consume bitter cassava, but they don't have but the cassava Konzo still persistent in Mozambique. Also, the other question is concerning the introduction, breeding of sweeter varieties of cassava to be a way forward for Mozambique. The bottom line is, and I just use the opportunity to see Dr. Litos, what is happening in Mozambique? Why don't we have the proper action to deal with early signs of Konzo and also to plan for the future? Is it the fact that there are so many competing priorities, health priorities, so that Konzo, given that it affects only 2 out of the provinces, is out of the radar? What is happening, Dr. Litos? What is your opinion?
Thank you, Prof. Muquingue. What I think that the government is really could be competing priorities, but as Dr. Nhassisco said, it's a disease of the poor. It doesn't kill immediately like other disease, and it doesn't call attention for other disease of emergency. It's something that in our engagement with the ministry, with the government itself, we go forward as if we are going to institutionalize it, but there is a setback that we can't reach there. I think there is a more concerted effort that we need to do between academia, also civil society organization, health practitioners, and community development officers, in order to ensure that we push the government that this is an emergency that needs to be addressed, especially if the social and economic conditions of the people who are affected continue the same, at least if they are addressing the other issues that are there. If we look at the case of Member and Mojingwal, the isolation itself, the road infrastructure doesn't reach there. It means that most of the services and even the goods are not able to reach there, and people can't diversify even their own diet. But it's still a call for action for the government to address more this.
Dr. Litos. Dr. Nhassisco, what is your take on this question? What's happening? Why isn't the ministry reacting? I remember that in 2021, there was a paper in the medical review of Mozambique that is hosted by the Minister of Health. And Professor Julie Cliff was asking exactly that question. 40 years later, what's happening? Why are we still seeing Konzo? And I believe nobody actually at the official level response to that. Dr. Dulce, what do you think about this?
Well, I think Dr. Litos talk much about that. What I could add is that, in fact, Konzo it has so many underlying factors, and it's mostly linked to poverty. And we know that the investment from the government of Mozambique to reduce poverty still inadequate. So first of all, we have to try to make sure that these communities have food, have access to nutrition programs, but even the programs that are being implemented by the MOH, the Minister of Health, or the Minister of Agriculture, don't reach the people in need in these very remote communities. So the few interventions that are being supported by the government have a very limited reach. The second aspect, most of us are aware of that most of the interventions in Mozambique rely on donor funding. The government doesn't have enough structure to implement its own programs. So this high reliance on assistance, foreign assistance, also puts a lot of challenges in addressing all these situations that we've been seeing around Konzo. I believe that the MOH is also concerned about that. But when we go to resources, to prioritization is another issue. We have so many public health issues in Mozambique. And as I mentioned, Konzo affects poor people, invisible people. So it's important really to bring these people to make sure that the government is aware that they exist, and that is a big public health. Third, we don't have data. We don't have evidence. We may not have enough evidence. I believe there are so many Konzo cases out there, but we are not able to report to have a strong or to make a strong advocacy on the government as well as on donor platforms and so on. So there are so many structural aspects that I believe should be addressed, and not just the MOH, but the Minister of Agriculture, the education. So it's a multi-sectoral, and coordination in Mozambique is not one of the best ones. So, but anyway, we have to still fighting for that. Thank you. Over.
Thank you very much. Dr. Adelaide, anything to add, please?
Sim, doutor, boa noite. Se tem
Colocamos
algo
uma
a
questão a
acrescentar,
provocar, sim. Por que é que não estamos a conseguir reduzir o Konzo em Moçambique? Na sua opinião, o que é que se passa? Over.
Muito obrigada pela pergunta. Acredito que tem muito a ver com também com os nossos ministérios, principalmente o Ministério da Saúde, que deveria se focar mais uma vez nessa doença, que é uma das doenças enviadas pelo Ministério, que deveriam ver para os próximos programas, os planos quinquenais do Ministério da Saúde, que pudessem englobar essa componente das doenças negligência, principalmente o CONSO, para ver se podemos fortalecer mais os nossos laços de integração, formação contínua dos técnicos, tanto nas zonas de recônditas, principalmente nas zonas rurais e urbanas, para ver se podemos conseguir reduzir esses elevados, a elevada prevalência do câncer no centro e no norte de Moçambique. Muito obrigada pela oportunidade mais uma vez.
Muito obrigado. In a summary, Dr. Gleadow was saying that we have to tie all efforts concerning reduction of consumption to national guidelines and policies that address development, especially in the most remote and rural areas. That would be the best strategy to approach that. But I see also that Dr. Desiree, from the experience that he shared with the Dr. Esperance on the work that has been conducted in Kahema and RDC, Dr. Desiree says that my own experience indicates that it is very difficult to get public health officials to have cons on their radar. Better to get cons tied to issues of poverty and human development. So this is aligned with what Dr. Dulce, Dr. Litos, and Dr. Adelaide said. We have to somehow put CONSO under promotion of poverty reduction and also promotion of human development. So I thank you all the speakers today. It was a so nice and so powerful session on public health. Thank you, Dr. Dulce Nhassisco, Dr. Adelaide Cumbane, and Dr. Litos Raimundo. And I just pass this to Professor Ross, please, for the next session. Over. Thank you.
Obrigada.
Yeah, thank you very much to all the speakers. And I think there have been quite a lot of questions and we haven't really got to them in detail, but I think these raise very important points, some of which we discussed in the session yesterday, is why don't we just plant sweet cassava? And there appear to be some yield benefits, some social differences of why that might not be. Someone else presented on the different genotypes and even the origins of breeding of cassava in different parts of Africa that may actually affect what stock is actually available for planting. And I think really what we're really seeing in the presentation today is that there is a need for monitoring and testing both of the plants and of the people. And Dulce, I know you've turned your camera off now, but I'm assuming you're using the kits that have been developed by Howard Bradbury. Do you get those from Canberra or do you make your own? Oh, you're still muted, Dulce.
Apologize. Right now, we don't have kits in Mozambique, but the ones that we used, we got from Australia. Yeah, so we are not developing yet.
Yeah, so there's a real need to have a greater availability of these kits. I mean, the great Howard Bradbury, who we are really honouring in many ways today with this symposium, developed this and the wetting method, both of which are incredibly effective, but they need to be implemented. We can see that requires government action, but it also requires international action to make these kits well enough available. And just while I talk about that, so the kits are made by the Australian National University, and this is the funding for that comes through the Conso Prevention Fund. This was set up as a memorial to Howard Bradbury. We've made this webinar free, but if you would like to make a donation, you can. I know that many people attending this are coming from poor countries, and I don't expect, or lower income countries, I don't expect you to make none of us expect you to make donations. But at the moment, even the production of the kits is really not secure because it relies on donation funding and volunteer labour. And a big shout out, a big thank you to Jan Elliott, who's the one that really makes these kits and makes them available. So just something on that. And then just in thanks to the previous, so thank you to all the previous speakers that we've had this morning, and of course the speakers yesterday. And I think we need to understand what's happening with the plant. I mean, I know I'm a plant scientist, but we need to understand that. We need to understand why some people get Conzo and some people don't. It's not that simple. And now we've got the things to relink with nutrition and public health, which are absolutely crucial. And the last session that we have starts in about 20 minutes' time. And that's going to be a discussion of food systems, which we believe will bring all of these things together. So I'll see you back in about 25 minutes, I think it is. So thank you for your attention. I'll see you then. I'll introduce this session. We've got participants on the Zoom session here, and we also have people watching on the live stream on YouTube. Isabel will tell us later how many people. But we've got some great participation from different people around the world, and with this session coming up. In a moment, I will introduce our chair, Louise Abayomi, who has been very helpful in the International Safe Cassava Working Group, which is a group of people who were interested. I think we'll have people mute or not talk. Yep. So this symposium is being, I'll just get rid of my slide. So welcome everybody, and we've had a lot of participation so far in the 3 sessions. We've already had 2 yesterday and one today, this morning for me. This has been presented by the International Safe Cassava Network, which is, and the network and the symposium's focus is on cassava and the diseases associated with it, especially conzo and the diseases associated with its, particularly its cyanogen levels. Who am I? I'm Gleadow. I'm a plant scientist from Monash University in Melbourne, Australia. Why am I interested in cassava? Because we don't really grow it here. It's because I'm interested in the effect that cyanide has in plants. And as I did this, I realized that there were these major crops internationally that contain cyanogens with associated diseases. This symposium is also being hosted and supported free of charge, I might add, by the Global Plant Council. The Global Plant Council is an umbrella organisation for plant science organisations across the world. They work to build a sense of community among plant scientists, disseminate research from all different sources, and also work with policy. So thank you very much, Isabel. We have the Chief Communications Officer with us, Isabel Mendoza, and she will be jumping in and out of the chat and doing various things. Also with us is Kira Ma. Kira is the person behind the generic email for the International Safe Cassava Network, and you will probably correspond with her. If you would like to join the Global Plant Council, this is something that organisations join. There aren't a lot of members from Africa organisations, so any research organisation or university or national organisation can join. So please contact Isabel about that. And if you would like to join the Safe Cassava Network, please email Isabel on the address that's in the chat. I was just going to say, Louise, who's chairing the next session, is a member of the working group who really put together this symposium and worked out how it would go. So it's a smaller group of people, and Louise has stood in for me as chair on multiple occasions. Now, before I throw to Louise, a couple of quick housekeeping notes. Please feel free to use the chat. You can introduce yourself. It's always nice to know what country people come from. But if you want to ask a question of the panel speakers that we have in this session, you will need to use the Q&A tool, which you'll see at the bottom, and type in your question there. So rather than putting questions in the chat, put them in the Q&A tool. Now, there is an option to display closed captions with translation. We did struggle with this in the last session in translating one of the speakers from Portuguese into English, but you may even find it helpful just to have English subtitles if English is not your first language. This session will be conducted in English, and that can be helpful, or you can try and translate. To do that, you go down to where it says show captions, you click on the arrow, you turn the translation on, and you select your translation language. Kira has posted information about that in the chat. So with that, I'll pass you on to the chair of this final session of the first International Safe Cassava Network Symposium. So Louise, over to you.
Thank you, Ross. And I would say a warm evening. I'm biased because I'm Nigerian. It's 10 o'clock. A warm evening, afternoon, and morning in that order. Welcome to this session. I don't need to introduce the Global Plant Council or the International Safe Cassava Network. This session, unlike the other sessions, is a panelist session. And it's going to be pretty much free-flowing. It should be rather enjoyable and quite interactive. It's not like held rigid. So if panelists, again, want to come into someone else's question, they're free to do so. We will have a round of questions, and then we'll go to Q&A, and then have another round of questions. Go to Q&A again, and we'll probably summarize and round up. There'll be a question for the audience as well. Without any further ado, for those just joining this session, I'm not sure whether you joined yesterday's sessions or even earlier today. We talk about cassava, which is a staple crop. It's also a strategic industrial input, and it's also a survival crop. And so therefore it makes sense when you're looking at the value chain to take a systems approach. We're probably here today because a systems approach has not been taken in the past. And this session really aims to pull together all the different disciplines within that system and try and consolidate and move that forward. So there've been a number of studies. I'm going to get into some numbers, and I'm sure Ben would like that. There've been a number of studies, for example, by the Nigerian Cassava Invest Accelerator, which is the Lagos Business School initiative funded by the Gates Foundation. There've been studies by IFAD, VCDP. There've been studies by the West Africa Competitiveness Program, and also NIH, Sahel Consulting, FAO. So respectable bodies, and they've found that there are a number of losses. So if we take first, I'll move to Conzo in a minute. There's been a lot of talk about Conzo, but if I look first at the losses associated with industries, more developed countries such as Nigeria and Ghana, for example, if you're looking at post office losses, for example, there was a study that saw there was a missed opportunity because of the losses, about $800,000 a year. And also farmer income gap between those in the value chain development projects and those that weren't, about $250 per farmer per year. We've heard of industrial starch import substitution, particularly in Nigeria, potentially $100 million a year. And so if you pull that together, I mean, Nigeria is the largest producer of cassava, though we don't export a hell of a lot. But the estimates from these studies say that it's between 150 to 300 million a year in losses combined. If we take a look at those countries that are prone to Conzo, such as Mozambique, Tanzania, Malawi, and so on, the impacts are slightly different, of course, because those countries don't tend to be so industrialized anyway. They say that productivity losses, for example, per affected child in their lifetime might be between $2,500 and $4,000 a year. Household income loss due to the caregiving, missed school, etc., could be up to $500 a year. And at the community level, where you have some of these outbreaks, for example, in DRC, there was a case study that saw the losses were between 2 to 3 million a year in those communities. So if we set the scene and have that kind of context, I'm going to now introduce my panel members. So if I could start with Professor Adrian Martin, who's the Director of Program Development at the Natural Resources Institute, University of Greenwich, and is a leading development studies scholar with expertise in social and institutional dimensions of agricultural systems. She's worked extensively across Africa, Asia, and Latin America, designing and evaluating rural development programs, and contributes to policy briefs for international development agencies. Her research includes gender analysis in value chains, multi-stakeholder innovation systems, and transdisciplinary approaches to agricultural sustainability. Dr. Okechukwu Senior scientist, IITA, head of IITA on this station, is a cassava commodity specialist and agronomist with over 30 years of experience in roots and tuber systems. He coordinates large-scale cassava production across Africa and leads outreach for the cassava transformation agenda. He's trained farmers and youth in agribusiness, seed systems, and post-harvest utilization. He's president of the International Society of Roots and Tuber Crops Africa branch and plays a key role in advancing cassava research and investment. Professor Ben Bennett, Deputy Director, Natural Resources Institute, University of Greenwich, is an expert in international trade and marketing economics with over 30 years of experience at NRI. His work spans agricultural value chains, post-harvest loss mitigation, trade policy in over 40 countries. He's led major evaluations for global donors and supported trade negotiations across SADC, that's the South African Development Community, COMESA, and his work focuses on integrating smallholder farmers into formal markets, especially through value chain development for tropical commodities and wild harvested products. Professor Latif Sani, last but not least, president of the International Society for Tropical Root Crops, also a visiting professor, NRI, is a renowned food scientist with over 3 decades of experience in post-harvest innovation for tropical root crops. Now the director of the Nigerian Stored Products Research Institute in Nigeria, has led many multi-million-dollar projects funded by the EU, Gates Foundation, World Bank. His work focuses on cassava seed systems, processing, and drying technologies. He served as VC of Award and president of the Nigerian Institute of Food Science and Technology. So that's the background of the panelists. And so I'll move straight into questions, if I may. So as we explore the food system, the cassava food system, I think it's essential to recognize that its potential is deeply intertwined with the resilience of communities who grow, process, and consume it. In regions where cassava is stable, you've got these recurring outbreaks of konzo, which is a neurodegenerative disease linked to poorly processed bitter cassava varieties. Bitter meaning high levels of cyanogens, for those that don't know. And we're going to move on to, so with that background, we're going to, so it underscores basically the need for stronger institutions, more integrated systems. Our first panelist, Professor Adrian Martin, brings together, as I said, experience in livelihoods and institutions. So I would like to ask Adrian, how do you view the cassava-based food system, the impact on livelihoods in those countries affected by konzo and maybe others not so much, like Nigeria, for example? Thank you.
Thanks, Louise. I expect everybody can hear me. This is really quite an interesting question because, in fact, the very factors which are threatening livelihoods or make livelihoods challenged are the circumstances in which konzo seems to appear. So those of you who heard the previous session will have heard about the association between konzo, poverty, and malnutrition, but also social conflict, disruption in social systems and production systems, migration, insecurity, even crop disease and drought. So these factors which create vulnerability in the livelihood systems are also factors which seem to predispose communities to outbreaks of konzo. That's because they disrupt systems, they destroy facilities, they displace people from homes, and so the access that they might have to their own cassava crops is limited. It may lead to shortcuts in processing, or they may acquire cassava from various sources with very little knowledge of the conditions in which the cassava has been produced and processed. So that's one important factor. And another area that was raised also in the previous session is the gender dimension, that konzo affects proportionately more women than men, and particularly children and young people, with consequences for their health, education, and their future livelihoods. And it is an interesting factor that the poorest and most marginalized people are particularly affected by Konzo. And it may be coincidence, but I doubt it, that perhaps this is why this problem historically has lacked a sustained focus in tackling it. Those affected are those with the least voice and influence. Anyway, that's the context of Konzo in challenged livelihoods. But the question really is, what can community and institutional interventions do to try and both address the problem of Konzo and promote sustainable livelihoods? So one of the first points I make, and I don't want to go on for too long, but is the need to understand those current systems, the current production systems, but also the processing and consumption factors in those vulnerable communities where Konzo might be expected to occur. That understanding then is the basis for interacting with communities and thinking of what community-led interventions can be developed. One important area is to build on local knowledge. We know that understanding of Konzo, understanding of cassava diseases varies a great deal between different countries and cultures, and it may contain elements of local belief systems. So understanding how people understand these problems is a basis for developing strategies to communicate, to enhance knowledge, and to eventually change attitudes and practice. There's lots of examples of community initiatives with addressing Konzo. DRC, some good examples. Trained women from communities in the wetting method. Those women then trained other women in their villages. They gained some support with tools and equipment, and then they spread that knowledge around the communities. Great idea. Such social mobilization can be very successful. However, there's a number of challenges. Apart from the challenge of coverage, it's in fact the very circumstances in which Konzo appears and that livelihoods are challenged that it is perhaps most difficult to get that kind of community action. It depends perhaps on volunteers, and women, as we know, already have a heavy burden of work, often unpaid work. So it's not a straightforward effort, but it is important to explore those community-based solutions for communication, for raising awareness. There are examples of community-based multiplication of disease-resistant varieties that have lower cyanide content, using local land, possibly sourced from government or schools or whatever, and then using mechanisms within the community to ensure distribution to those who can utilize it, and including those who are most vulnerable. In terms of broader livelihoods development and support, then there's a whole raft of other possibilities: support to sustainable agriculture, small stock food crop diversification, and diversification of income generating opportunities, particularly for women. And then in terms of the information and understanding of the problem of Konzo, and indeed to access any of these other livelihood opportunities or information, there's an important aspect of tailoring communication efforts. And there's a whole range of possibly quite creative ways of doing that. Mobile phones can be used in some circumstances, social media, but just old-fashioned things like posters, leaflets, etc., to get messages across to people. You can use community drama and group discussion and learning as well. I think I might stop there, but just to finish with this start of the discussion, I think also within this debate about Konzo and livelihoods, it's important that the institutions involved recognize the significance of these social factors, the dimensions of poverty and gender, and how opportunities can be introduced and made available. Recognizing, I think, women's agency as producers, processors, and consumers, not a group of people to have things done to them, but to be enabled to add value to cassava, to make a contribution to livelihood growth, to generate their independent income and contribute to their empowerment. So I'll stop there. I hope that wasn't taking up too much time, but maybe there's a few points that others can
that was
pick up
perfectly
on.
fine. Thanks so much, Adrian. If anyone in the audience do have questions for Adrian, please just park them for a moment while we just continue. I think we're going to lead now into pick up on the seed systems. And so I hope you recognize that the seed systems are foundational to productivity and resilience in cassava food systems. And so our seed system specialist, Professor Okechukwu, will explore how innovations in planting material distribution and varietal development can support safety and climate adaptation. Professor Okechukwu, welcome again. How can the cassava seed systems be better integrated into cassava food systems to ensure timely access to clean, climate-resilient planting materials?
Thank you, Louise. I hope everybody can hear me. Good evening.
Good evening.
There's a big, strong connect with the seed system and food safety. One connection is that without a formal system of deploying improved varieties into the network of farmers, you can't be sure that you're getting healthy plants. And if you don't get healthy plants, you're likely to be getting infected plants around. And if you have infected plants, you're going to have low productivity. And once there is low productivity, you're also going to have challenges with food security. And with that being in place and cassava being the main food security for very poor families, it becomes very drastic that they can go processing it in any way they want to survive. I give you a good example. After the Nigerian Civil War in 1970, those are the times that we noticed this Konzo in Nigeria. It's not much these days. I agree with the previous presenters who mentioned that it has to do with nutrition. And I say it is a disease of the poor. So not until we realized the connection with cyanide and people started using palm oil in their processing of the cassava or having to boil it with palm oil, were they able to manage the cyanide poisoning level for eating the bitter varieties. So right now in the northern part of Nigeria, you still find the very sweet varieties, and it is hot and people eat it. And at times, unknowingly, people eat the bitter one as well. So there's quite a lot of knowledge in processing in Nigeria that helps to manage high cyanide varieties that are abound everywhere, because we are becoming going more industrialized, and most of our breeding materials are tending towards the bitter varieties, because the bitter varieties are more resistant to diseases and they also give you higher yields. So a good system has to manage these various levels of demand. People still want to get that sweet varieties, and people still also want to get the bitter variety. So that connection is there in providing a healthy plant. Another key connection is that cassava has a lot of water in the root. So if you produce a high-yielding variety with a low dry matter content, that means that root, if you want to dry it, is going to take a longer time to dry for those that have to process it into chips or chunks of flour. And once it doesn't dry very well, it becomes susceptible for infections of fungi that will cause all kinds of toxin problem and so on. So a seed system will take care of breeding high improved varieties, low cyanide or high in cyanide, but at least with high dry matter content, so that drying will be quicker and there is more food for whoever is going to use that material for processing into food. And that way there'll be less adulteration, and the material, the food provided is also available. The good seed system will also take care of the issue of nutrition in terms of now that we have the high beta-carotene varieties, to also have those varieties as sweet varieties. Okay, so that way we are targeting low-income homes that can eat it and boil it like the way they use yam without having to be looking for palm oil to add to that food base. So I say we don't have much of the konzo anymore in Nigeria, but with the large way and the knowledge people know about processing, detoxification is much easier for the root. And so countries that still have these challenges, we have to develop a way of communicating post-harvest processing. Okay, post-harvest processing will make a big change in that system. So the seed system is the foundation to get a good crop, and to get a good crop, you have to address the needs of the off-takers. Thank you.
Thanks so much for that. And again, anyone has any questions for Dr. Okechukwu, please just park them for a moment. I'd like to move on to, we talk about productivity, which is of course important for markets. Markets are the engine of cassava value chains, but they're also shaped by systemic barriers and incentives. Marketing economist, Professor Ben Bennett, hopefully will help us unpack how these market dynamics influence access, equity, and safety across the cassava food system. Ben, what systematic barriers in cassava markets limit, do you think, equitable access and profitability? And how can these be addressed to strengthen the overall food system?
Thanks, Louise. The job of the economist in these sorts of situations tends to be to make long lists of why things don't work very well. I'm sorry, this is going to be a long litany of why things don't work very well. And you know, moving on from what the last speaker was talking about, the systematic, but almost everything is a systematic barrier in the cassava subsector. It's hard to look at anything that actually creates a smooth running or creates a properly connected system. I'm going to split this up into three areas. Firstly, looking on farm, then in the chain, and then at the factory, across the value chain. So you're right. You know, I'm an economist. I'm interested in productivity. At the end of the day, Richardson's hit the nail on the head. We need to deal with the productivity question. Otherwise, you know, we can never make enough money to have a sensible livelihood. Maybe we shouldn't be a farmer. Maybe we should, you know, heaven forbid, we should go and do something else. So we need to be productive, and we need to make an income stream or have enough food to feed ourselves. Productivity is a central issue in this, as far as I'm concerned, and we will always come back to it again and again. There was, in the 90s and the noughties, there was a big gain in productivity. There was a big increase in cassava production across the world, but particularly in sub-Saharan Africa. Noticeable response to governments reducing subsidies of maize, and climate change, and you know, need for resilience. A very convenient and easy crop. Cassava suited people's way of life very well. Stays in the ground until you need it, which is a big advantage if you're a smallholder. So we saw a big gain through the 90s and noughties, but I was looking at data a few weeks ago. Over the last 5 years, we've hit a plateau, and we seem to be stuck again, which is really quite troubling. So there was a huge effort, and I'm sure Richardson was deeply involved in this, in new varieties that were dealing with some of the big viruses that were plaguing cassava, smallholder cassava particularly. It was very successful, and it helped some of those productivity gains. But it's got stuck. And why has it got stuck? I guess is the question. What's the systematic reason why productivity, in Africa, it's plateaued at around 50 to 20 tons per hectare, with one or two exceptions, but not many. The world's top producers are getting 30 tons plus a hectare. So, you're never going to compete on the global market. You're never going to encourage investment to productivity that low. Cassava in Africa is still a smallholder subsistence crop. The farms are small, and they're doing lots of different things. They're not just producing cassava, and that needs to be borne in mind. While, that is a successful subsistence strategy, if you're going to survive, it's not an optimization strategy. Effectively, no agricultural inputs are used. So, there's been some wonderful strides in new planting material, but this is a vegetatively propagated crop. The easiest and simplest thing to do is to chop up the stems and put them back in the soil every year. If you are far from a source of new material, you've got a problem. And I'm hoping Professor Sani will come with some clever solutions to this, because he's up after me. There's almost no agricultural mechanization. Cassava is a big, heavy crop. It's I'm sure you pulled it out of the ground, Louise. I certainly have. It doesn't want to leave the ground, this crop. It's a very, very hard and heavy crop to move around. It's mostly fiber and water, as Richardson has just explained. Very few farmers have contracts or have relationships with the people who buy the stuff from them. So farmers end up being price takers instead of price makers. And they also tend to side sell if there's an opportunity to side sell, which is, means your relationship with the next person down the chain is not fixed, is not mature. The farmers don't seem to realize, and I don't really understand why, the industries across the world have not got this message across in many countries, is that what we're talking about is starch here. This is a global trading, growing and producing and selling starch at the end of the day. So starch content is what we're looking for, not big lumps of cassava. The fact that this is missed is a systemic problem across smallholder cassava productions. In countries with strong small-scale processing, like garri making, there's very little incentive to continue supplying a factory if the garri price goes high, which has happened, recently in Nigeria. We got a boom in local prices for cassava and for garri, so people rush to that, and quite sensibly, it's a normal response to a price increase. Very difficult to manage a big factory if your supply suddenly disappears every few years because the price of the alternative crop goes through the roof. Very few farmers collaborate to harvest and transport. So we have many wonderful experience, and I appreciate Adrian's. There are some great examples, particularly women's cooperatives working well together. But the volumes that we've managed to move through these methods over the years remain minuscule in comparison with the total production of a country like Nigeria. It's still very small. We've never really gone to scale. Harvesting and peeling still done the traditional way by hand. It's extremely labor intensive. So within the chain, rural roads in southern Nigeria, the roads are terrible. The rain is heavy, the mud is thick, and the policemen are many. Shall I say? I think everybody knows what I mean by that. So it's very challenging getting your product to market. I did a study a few years back for a project looking at the number of times one piece of cassava After you took it out of the ground, how many times it was dropped and then picked and then dropped and then picked. We got an average from farm to factory of 17 times a piece of cassava was picked up and dropped down again. That's, you know, it's a very soft commodity. It's a very easily damaged commodity. Picking it up and dropping it 17 times. You wouldn't do that with a tomato. So why do you do it with a piece of cassava? Cassava's a low-value bulk product that's highly perishable once harvested. There's very little incentive to take any risk, as there's no premium for high starch content. Nobody's paying for the starch, which is what they should really be paying for, or discounts if the product's terrible, if it's sat by the road and been smashed to pieces. So what we call this is a race to the bottom. It's a low-quality, low-value product. So the way you deal with that is you need to work it towards being a better quality, higher value product. At the level of processors, there are very few successful large-scale cassava processing factories in Nigeria or Ghana or across Africa. Why is that? Still, after all these years, you know, in the post-independence period, it's been a story of big investment and very little success. One or two examples, but very little. So in West Africa, the price of cassava is set by the price of Gari and Kokonte, and this has made most factories uneconomic. Rural power is awful in most of these places. You cannot run a factory for 3 hours a day and stop it and start it. You need to run it 7 days a week and 24 hours a day to make it economic. So until that problem's solved, you're never going to get anywhere. Buyers pay for cassava by volume and not for starch. I think I've hammered that point home enough. Cassava flour is an industrial ingredient. It's an intermediate good. The product that you make in one factory has to go to another factory to make a finished food. And the policies and incentives need to address the fact that there's two levels to go through where you need to give incentives. So, you know, if you are importing very, very cheap wheat on the global market and it undermines your domestic cassava industry, who's going to invest in the domestic cassava industry? This is a systemic problem in national policies that's never really been resolved. And then finally, at the consumer level, I think consumers have developed at the higher level of consumer, at the emerging middle classes and the city consumers. I think they're worried about cyanide. I think they're worried about all kinds of food safety problems. And cassava's, you know, generally considered to be a low value food compared with something like wheat. So, you know, you'd rather feed your child a burger with fries, and you see the Irish potato, you know, production is growing much faster than cassava production across Africa. And that's what the young mothers, young parents who are ambitious want to feed their kids. It's a normal part of urbanizing economies, shall we say. So lots of problems. What are the solutions? Well, they're the same solutions that we had 20 years ago, it seems to me. We need larger, collective, more productive farms. We need policies to promote larger scale processing and more consistent relationships between processors and groups of farmers, as they have in the very successful cassava producing countries. We need targeted improved rural infrastructure. We need policies to incentivize cassava use over imported flour or you know, other alternatives to cassava. So there is stuff that we can do, but it would result, you know, it's going to mean some pain. I like to finish on pain. It seems.
All right, Ben. Oh, you made me laugh with the pain part there. Thanks very much. So I want to pick up on technology, which plays a transformative role in cassava food systems, from processing, breeding, processing, transporting, so on. And I want to bring in Professor Sani at this point to share some insights on how innovation can drive efficiency, safety, connectivity across the value chain. For Sani, what emerging technologies in your mind have the greatest potential, do you think, to transform cassava food systems, particularly in processing, traceability, and food safety? Thank you.
Thank you very much for this opportunity. It is good that we are interacting and discussing on adding value to cassava and making sure that they are safe and at the same time they are competitive. When you are talking of innovative technologies, there has to be at the scalable level. Like all of you have said, most of our production or processing of cassava in sub-Saharan Africa, Nigeria in particular, have always been at the small to medium level. And the implication is that their processing machineries are batch operated, unlike in Brazil, where they have the dual, both the batch and the automated. In China, it's purely automated. In Singapore, it's purely automated. So for Nigeria level and Ghana and African level, they have batch operated processing machinery. And this is limiting the turnover rate, the capacity that they can do. The second layer of innovative technologies is on the product itself. The most tradable industrial product now is food grade starch. Now, if the Nestle, Unilever, Capri, all these multinationals, they need the starch and they also need high quality cassava flour. And at the level of traceability and quality that they needed, purely it is mostly imported equipment that can withstand that kind of requirement. Now, if I tell you the cost of ordinary 20-ton dry cassava starch or HQCF from China, as I'm talking to you, has risen to about 900,000 tons, $900,000 for processing machinery alone. And that brings in incentives or credit support for intermediate investors, processors, that will be able to put that kind of machinery down. We are very lucky in Nigeria. Before we closed the Cassava Added Value for Africa project in 2019, we had about less than 5 starch industries. As I'm talking to you, we have close to 11 starch industries now because of the market that is there for them. And each company needs nothing less than 240 tons of cassava root in a day. The ethanol has also risen beyond the ADA that we cited in Igbesa in Ogun State. Now we have about 5 ethanol industries in Nigeria and about 4 agroecological zones. And that is bringing in more investment opportunities and new players entirely into cassava. And because of that, the issue of hazard analysis critical control points, the issue of certification process are now coming on board. And unfortunately, we are limited in terms of human resource to be able to respond to that kind of and calling for North-South collaborative and partnership process. So I would say that if we are talking of innovative technologies, we are having some. At Tokonzo, if you recall, most of the first batch processing equipment were the issue of make sure you grate your cassava and you press your cassava. If you can do that, you are removing iron percentage of cyanide, the cyanogenic potentials immediately. And there has been several publications by Muquingue et al., Onopolu et al. In Nigeria that they have done something like that and showcase that if you can do that. Latest information is also that even the greater, the action zone must be stainless steel. And the pore size must also be well refined that they can be able to churn the cassava very well. It is then you'll be sure that most of these cyanogens are reduced. So there are different layers of innovative technology that you want, either at the small level, medium level, or large scale level. But the real gap is on the quality assurance, quality management, and traceability. I think there are a lot of gaps there, which Louise herself can also attest when she did work under the Cassava Added Value for Africa, and she assessed some industries in Africa during that time. Thank you.
Thank you, Prof. Sonia. I think that was really insightful. And I think that last point about, you know, the technology, the grading links back to what Professor Martin said about when you get these communities with outbreaks of Konzo, one thing you need to do is look at the systems there, look at the varieties there, look at the technology there, before you can even decide what kind of intervention to make. May I come to the Q&A at this point in time so that we don't lose if people have questions, if that's fine with you? I don't know, Isabel. Hi.
Hi.
Hi. Are you able to? I mean, I can't see. I can see.
I can read it. I can read them out loud.
Okay. Okay.
There is one question. Is there any synergy among cassava scientists in Africa, essentially between your and Dr. Okechukwu and countries with high incidence of Konzo?
I will say that we have platforms where we meet. We have the ISCN, which is the International Society of Root and Tuber Crops, Africa branch. And in these meetings, I've attended some where issues of Konzo have been presented. We have other platforms like the Breeders Association and so on. There an ITA being in the different zones of Africa, interact with national scientists in different groups to look at these issues. So I will say that countries where Konzo are of high incidence do have relationship with scientists. What normally happens is the downstream. How do you pass this message effectively down to the rural communities that they can start to take up those changes, those advisories, get those machines that can crush that cassava, change their processing method to avoid this problem. So the more you can have that downstream advocacy and extension service functional, I think that is where this problem can get to disappear. But we do have scientists that are interacting with national scientists, but is passing this message down to the poor of the poor. So I think there's also need for some policy support in this aspect. Thank you.
I think, would anyone else like to contribute to what that question or answer that question? Otherwise, there is another question, I think, in the Q&A, or there was, but it's gone now. So,
yeah, it just went it because Latif has done a written answer.
Yeah.
It was directed towards Dr. Richardson about post-harvest processing methods that are used in Nigeria that may contribute to the reduction of Konzo.
Yes. Yeah, the key processing method is to be able to crush the cassava. Once you can crush the cassava and apply some form of heat or the watering, cyanide level is reduced drastically. But when you eat it raw, and that is where your body is not taking a high level of cyanogenic material, and that's where you get that problem if you are nutritionally poor. Okay, you don't have other means, other food, no palm oil in your food and so on, then you can start having those symptoms. And usually it is fed to kids, to children who don't have choices. So if parents know that they can actually crush this cassava root, fry it, roast it, turn it into some fufu or something, and feed it to the kids with the sauce with palm oil or so on, then they will not have this type of problem at all, because it is purely due to consuming high level of cyanide that causes the problem.
Thanks for that. So on that note, may I come to Adrienne and ask what strategies you think might strengthen coordination?
Louise, before you go, I think Rose is raising up her hand.
Oh, sorry, go ahead.
Oh, yeah. So I just wanted to just follow on from that idea of processing. And it seems to me that there seems to be, depending on the bitterness, that the amount of processing may be different. And my question is it wetter in the areas where they grow cassava in Nigeria and Ghana, for example? Because we know that the bitterness increases in dry regions. Maybe Ben could answer that best.
Well, not sure whether I can answer that best because I'm not physically there, but the big cassava processing region in Nigeria is the southern part, has a very high rainfall, very high humidity. So the challenges of drying in the humid tropics are one of the reasons that we get these kind of losses in cassava. It's a very, very humid and damp environment, very difficult to, if your drying strategy is to chip and spread in the sun, and it's very humid and very wet, you're very lucky if you manage to dry to a reasonable level reasonably quickly, and that affects all crops, everything that you want to dry, everything you want to store and keep, and causes all kinds of other problems, as Richardson's already said. The aflatoxin challenge, I think we'll bump into later.
Yeah, so I mean, you've got those downstream post-harvest issues, but of course the plant itself may be less toxic in a wet environment than in a dry environment. I'm just trying to throw this in as a bigger, because there's quite a bit of research that the plant itself makes more cyanogens when it's dry.
Ross, not necessarily the plant itself. You see, every cassava variety have their own genetic makeup, and the bitterness in breeding is closely associated to disease resistance in the plant, and it's also associated with higher yield in the plant. So if a breeder is going to take those traits to increase the high yield and also high dry matter of the variety. Now, the other part is that the sweet one, which is the one some people can eat without crushing it or that can cause this problem, very highly susceptible to mosaic. And also the root sizes are never big. They're just like carrot, very small roots. So you can't turn that into an industrial processing material to sell to an industry. It has to be something purely for food. So it's not the wetness of the environment that gives the attribute of the bitterness to the cassava. Cassava can grow in almost all agroecologies as long as you give it 60 days of water. So from the Sahel region of Nigeria to the mangrove region of Nigeria, cassava, there are varieties that grow there, and it just has to do with the genetic makeup of the material. So a good system that allows farmers or off-takers to know which variety they are taking and their processing will help in sorting out people picking a wrong one. It's just like eating mushroom. When you don't know the particular type of mushroom, you can be poisoned, and some are very safe like that. Thank you.
Ross, I think that answers your question. I think there's some more questions in the chat. There's one for Professor Sani asking what the main reasons for the stagnant cassava production are. saying we had huge investment in the last 3 decades and some of the best technologies applied in Africa, but still the production problem persists. Would you like to comment on that, Professor Nansani?
I think the greater problem that we caused for cassava in Nigeria, including myself with the scientists, was that after our good activity around the 80s and late 90s, we pushed the cassava adoption to the policymakers. We spent quite a lot of investment time for almost 2 decades now, situating cassava around the policymakers, presidential initiative of cassava in Ghana, in Nigeria, and all over the time. When you have an effective minister like Aki Adesina, immediately he leaves office, another minister comes, he nosedive cassava effort down. And then we made mistake of pushing high-quality cassava flour inclusion, which the flour mills actually blocked. So yes, we have investment all over, but because of this somersault of policy implementations and commitment, it affected the off-taking of the cassava products. Where we are very lucky in Nigeria now is while we concentrated on HQCF, food grade starch was more or less moving linearly up. It was not policy driven. It was purely market driven. And ethanol also is also moving up, not policy driven. And that is why in the last 3-4 years in Nigeria, those are the areas now that people are investing on. I think that's the problem that caused that downtime. Thank you.
Thank you. I think Isabel wanted to come in on that as well. Isabel, do you still want to make a comment on that question?
No,
just
really.
move on.
Yes.
I think she
Okay.
was just saying that it was going to be answered live.
Oh, okay.
Exactly.
Sorry. Okay, so time is of the essence. We have half an hour left and there's lots to say. Can I just go around to my second round of questions now? And I'll start with Adrienne. So what institutional policy innovations, Professor Sonia has talked about policy changes, changes in those that are responsible for driving growth and so on. So what institutional policy do you think are needed across the continent to scale up seed delivery systems? That wasn't for you, was it for you? No, it wasn't for you. Please do forgive me. That is Professor Okechukwu.
Mine is strategies to strengthen coordination.
Yes. So strategies coordinate. We keep hearing about, oh, the left isn't talking to the right. It's the same story. How can we have better coordination between agriculture, health, social institutions to move things forward and make it more resilient? It's over.
This is a really tough one again. Coordination, cross-sectoral coordination is something that's been talked about for so many decades in other circumstances as well as with connection with cassava. But and I was also interested in the question earlier about cross-country communication and coordination as well. So this is a really very big question. What to do about it? I mean, I think national policies of encouraging multi-sectoral approaches in general, and specifically in terms of rural productivity, I think that would be good. Embedding it in policy, embedding it in clear statements, which would encourage different sectoral institutions to look more to coordination. But there has to be encouragement and impetus for coordination. It has a cost. It takes time. But ideally, coordination between nutrition, health, agriculture, research and extension, and then even bringing in other areas such as education, infrastructure, etc. That seems to me to be a really productive way forward. But also at the more local level, possibly at district level or province level, depending on country, I think the challenge is then to find an integrating mechanism. How are these people actually going to work together? I think there was an example earlier from Mozambique. They had like joint teams, almost like task forces locally, bringing together these different organizations in particular locations to identify common interests, engage in first-hand community consultations, and together engage in looking at how together they can build food systems that are both safe and economically empowering. I think the benefit of those task forces or teams is they're, in a sense, think tanks for developing collaborative initiatives. And that's perhaps where real impetus for change can take place. And that might be introducing new varieties, processing equipment, developing nutritional messages, looking at schemes to encourage processing enterprises, to support business development, to look at mechanisms for finance, as well as the food safety and nutrition aspects that are partly driving this. And then the third area for collaboration is combining the communication so that each sector, in providing information on cropping or agriculture or health, tries to integrate significant information and messages from other sectors that affect the cassava food system. So that's very brief, but I think some of those points are important. Sorry, another mechanism for collaboration would be looking for funding, because some of these initiatives would need a kickstart investment. Thank you.
Thank you. Would anyone else like to come in on that question? Feel free to do so. Any comments at this point on that? Otherwise, I'll move on to, we're going to come back to that, Adrian, when you bring everything together. Otherwise, I will move to Dr. Okechukwu. But, so I'll come back to the question that I wrongly posed for Adrian. So what institutional or policy innovations do you think are needed across the continent to scale up seed delivery systems that support productivity and food safety in the cassava-based food system? Thank you.
Yeah, thank you. I would say that Basic 2 projects that just finished started what they had as seed system strategy for different countries. And it is that kind of approach that we need to have for all African countries that have to deal with cassava. There has to be this seed system strategy developed and owned by the national institutions of these countries, because anything that has to do with cassava cannot be done in silos. You need a combination of the presidency, the Ministry of Agriculture, the Ministry of Land, the government, the private sector, the industrialists, and so on and so forth, to all sink in for you to have something that will make the farmers have a strategic target of where they can be sending whatever they produce to go to. Because if anytime they produce and there is no offtake, there's going to be glut, and many families will suffer both financially and even death that will happen in such a situation. So this seed system strategy is a good policy thing that needs to be expanded to every country, and then have a real way of certifying seeds that are being disseminated, because most times when you give out planting materials to farmers, they lose their identity. After some time, they don't know the name of that variety anymore. When you go to people's farm, you see mixtures of different varieties planted in their farms. And many of them, again, are not very knowledgeable on some of these dangerous viruses that are there. I'm sure in the East Africa, yes, they know brown streak, but nobody in West Africa farmer knows about brown streak. So imagine if brown streak disease should enter West Africa, it would be a big disaster. So that kind of having that overall leadership and coordination in various countries on how the seeds move will be a big game changer in the policy. And then that, again, will help industrialists who will be targeting to offtake high-starch materials. They will know how to place order, and they can get what they are really looking for. And then for food consumers who want to eat their cassava raw or want to boil it and eat, they will also know how to select materials that are safe, low in cyanide, and they can know how to process that one. Thank you.
Thanks for that. Does anyone else want to come in? No? Okay. So may I ask Ben, how can market incentives, you touched on it earlier in the first question, but how can market incentives be designed to promote food safety, quality and value addition without marginalizing small-scale actors in the food system? And I guess that touches on also on what Prof. Sani was saying, you know, you need these larger bods. So how does that work? What does that look like?
I think protecting the marginalized with incentive systems and strict rules and food standards is extremely difficult. We've tried it with lots of commodities and lots of different places. On the whole, we're not throwing people into jail for not meeting a standard X and Y because it wouldn't be appropriate. So I think this is a wicked problem that countries face. To try to police standards without hurting the vulnerable is almost impossible. I think Richardson may have hit the nail on the head there when it made me think. And you know, perhaps I shouldn't say it out loud, but perhaps Conzo is not a bad enough problem. I know it's a horrible disease, and in its worst form, it is really dreadful. But it's currently not big enough and bad enough to get anybody's attention. And you know, hear me out on this, because I want to explore this idea a little bit. When I've seen investment and things change and stuff drawn toward incentives, money drawn towards a problem, it's been when the problem has been so huge we have to do something about it now. So you know, Conzo has bumped along in the background happening, but nobody's actually invested anything in doing anything about it for a very long time. You could say the same about aflatoxin. I deeply suspect that we will one day find that the cost to society and to the economies of many tropical countries of low levels of aflatoxin ingestion has been huge, and it just wasn't big enough that we did anything about it. Sadly, the problem was too big. I think there's another problem with cassava that we're not facing. I think cassava is picking up heavy metals, and we're not testing for it. We know that in some parts of the world where there is very large amounts of background heavy metal, that this has started to emerge by accident. I think there needs to be a focus on bringing all of these food safety issues together and making them into a really large food safety issue that's destroying people's ability to learn and to grow, and killing folk too early. If you put them all together, it becomes something much bigger and much more scary than a rather small problem. Sorry, Louise has heard me thump this tub once or twice before, but it troubles me that we're not addressing these food safety problems in a systematic way, because it's not just Gonzo, there are other things that vulnerable people are having to deal with in their nutritionally disadvantaged lives. I think we need to move to a starch-based system. I've never really understood why we have an economy, a cassava economy. You know, if you go to Brazil or Thailand or anywhere else, farmers know how to measure the starch in their cassava, and they pull it out of the ground when it's got the highest starch level, and they know that the person buying it will measure the starch. Just doesn't happen in Africa at all, and I have no idea why, because actually you don't need a complicated machine to measure the starch level. It's a very simple, you know, chopped cassava in a bucket on a weighing scale will do it for you. It's not a difficult thing to do. It's not an expensive thing to do. So I'm just baffled by that. I don't know why that hasn't been taken up. I think these problems are solvable, but you need to be well organized. Adrian's absolutely right. You need some collective effort, some innovation systems, something that engages everybody, and makes a plan and goes on a pathway towards a solution. Other countries have done this. When I first went to Thailand in the 1980s, you know, their cassava productivity was worse than Nigeria now. But they got their act together. They made a cassava plan. They built the infrastructure. They encouraged the investment. They gave low-cost loans out, and you know, they exploited their comparative advantage. And you know, Nigeria, Ghana, they have comparative advantage in cassava production. They need to exploit it. They should be beating the rest of the world. And it's an indictment of, as Latif says, you know, repeated policy failure by successive governments that we're still here today. And Latif is not cassava king of the world. I'd like to end on that. Latif is cassava king of the world.
Prof. Sonia, would you like to comment since Ben mentioned your name? Before I move on to the question for you, by the way, your last question. Want to comment on what Ben has said?
I think that the combination of food safety issues will be more relevant now rather than an isolated case like Gonzo. In Tanzania, what is befalling them is a bacterial blight. Whereas in Sierra Leone, Liberia, West Coast now, the same bacterial blight is coming on board, but the dominant one is the mosaic disease. So by the time you look at, and in Southern Africa, that's where you are talking Mozambique, you are talking of Gonzo, the part of DRC Congo, you are talking of Gonzo, something like that. So I think as professionals, I want us to take home food safety matters, and let us document the best practices and how best can we scale those best practices into the regions where we know that there are gaps. If we can do that, it's going to help a lot. Ben is talking about weighing machine. Nigeria, Ghana have not moved into that because 97% of their cassava goes to traditional markets. It is just of recent that you are not talking of serious industrialization. And I'm telling you, they are already doing that weighing scale that you are talking about. Nobody says to most of these large-scale industries, if they do not calculate your starch content, and farmers themselves now are aware of it. Don't forget, in Kava, we also introduced these gravimetric weighing methods to some of the farmers groups, which they are also cascading one way or the other. But the incentive for whatever practices you want the actors to do is, once there is market, assured market, then you see them adopting whatever you want them to do. Over to you, Louise.
Thanks very much for that, which leads nicely into the final question, which is how can digital platforms and data systems be leveraged to improve coordination and transparency across the cassava food system? And this applies to whether you're in a Konzo hit region communities with, maybe high cyanide varieties and droughts and so on, poverty, and also countries such as Ghana and Nigeria.
Well, I think I hope you know that the Gates Foundation has a new thinking now. The Gates Foundation is ready to sponsor anything artificial intelligence, digitalization process, and some other things. I deliberately bring in the issue of Gates Foundation to let you know that we lack data repository mechanisms in sub-Saharan Africa. And this is the period we need to latch on the digital age to actually expand on that. Two, in terms of training, there are so many ICT-related training modules now that could be able to assist in different languages and that people will not have any problem. But nobody as of today in the cassava sector in Africa that I know are investing efforts on that. So the issue of digitalization is very important. And how do we have Internet of Things in whatever we are doing, from production to the seed development, to processing, to marketing, and even to policy one, who says that we need to be rewriting policy all over. We can look at what worked where in Thailand, in Brazil. These are the real countries that are making billions of dollars on cassava in the global markets. And those are the things that I would say digitalization is very important, but all of us, we are yet to actually use it more to advance the cassava sustainability in Africa. Thank you.
Anyone want to comment? Any challenges you see with that? Who might drive that? How might that be sustained? Yeah, because it seems we know the kind of things. There's some, for me, really, really interesting ideas coming out, which may have not been explored in many projects or programs in the past. But again, someone needs to drive it. And if this is going to be coordinated at some level, then someone needs to take the lead with all these things. Do you have any comments on that? Otherwise, we're still working in silos. And that question is to anyone.
I just want to say that many national institutions have a lot of data, and it's just with their national institutions. And also the universities and the research institutes all do have different levels of data. Okay, so we just need a catalyst to start somewhere to where we can have a central metadata base or somewhere hosted in the cloud that people can start accessing. So those kind of design has to be something that will show some form of reward for people that will be able to put in their data in that system. If there is no form of reward, the way is here, everybody will just go and you retire and you die with your data in your head. Okay, so there has to be a reward system, just the way people publish their journal paper. Since we need this kind of data, we need to write a proposal or something to start the warehouse and start collecting. If it's on the breeders level, then we move to the agronomists, to the food technologists, and every student that does a research sends a copy of whatever he does to this database. So the cassava network needs to kind of be activated and to be a professional organization, not just an association we get to meet and something if really we need to have this kind of thing started in Africa.
Can I ask, how far are digital platforms being used by cassava producers and cassava industries for marketing purposes, for negotiations, for buying, selling, etc.? Is it being used as a commercial tool?
I would say that for Nigeria, many of them are searching for those kind of data, and most of them, before they started, had to do their own individual investigation on data collection, on market prices, and production stuff. Some of those historic information can be found in the ministries of agriculture because they have got workers at different levels in the local government and different villages. But most of their data is not real time. So most industrialists look for such information, but they have to augment it by doing their own independent research. So if there is an active database, real-time stuff where that is being updated, I think it will go a long way in helping newcomers that want to engage. Okay, and what you've just asked is just on the price side. But there are also a lot of other data that has to do with the production, the plant, the system, the agronomy, especially agronomy, because cassava is a crop influenced by the environment. So the same variety that will give you 20 tons in one soil will give you 5 tons in a different soil. So keeping those kind of information to advise somebody who wants to go into a 10,000 hectares of farm it will be very vital information to be made available. So such information exists. Some of them are hard copies. Researchers that have done this work have since left agriculture. Some have died, and so on, and it's nowhere. Someone like Professor Koroda, I'm sure some of you know him. You know, he's done extensive work on a lot of cassava, but where is all his stuff today? So many of them, Professor Nweke, there's so many of them who've done a lot of long-time work on information that we can have in this repository. I think it's something really, that can get.
My question is really more about using a platform as a space for transactions, much as you would as like a digital marketplace. I completely take your point about the importance of the information repository, and that's a very important resource.
Yeah. There are outfits now that are setting up those kind of platforms for digital marketing. Yeah, there are outfits that are, I think Sahel Group and some people are setting up those kind of things. And I think under Basic 2, they also try to set up similar kind of platform. There are also some other projects that have that, but we don't have one big national one that everybody can dial into and do that transaction. Yes.
Thanks so much for that. In the interest of time, and it's really, really late, I just want to make some comments before. So I wanted to ask you about the enabling environment quickly, because distributing improved seeds, for example, without any processing infrastructure is clearly a wasted potential. Promoting cassava flour without safety standards being monitored is also a problem. Or supporting SMEs without market access, there's going to be limited growth. What does it say, and this to anyone, about the enabling environment? Because even to get to some of the, so it can be even in the Konzo-prone area, bad roads, even if you wanted to test, you have to store the kits in the fridge. How do you address, because these are really big problems. We're talking about different problems across different parts of the chain, systemic problems from government policy and so on. But to move forward, to address, to come together in such a way that tightens up where we've been from now. And I would like to even talk to Prof. Sani, because I know recently, was it yesterday, there was a bill introduced to include, to make it mandatory to include cassava flour and so on. Again, even with that very excellent idea, I think, know that, as you said, the millers don't want to take it. They'll cite unreliability or quality problems, or whichever way, they'll bring any excuse not to do it. And in part, they're right. I've tested quality, high quality across different companies, and it's inconsistent. How do we strengthen that? How do we, as Ben was saying, you need some incentives and so on. So there are two different things here. There's your survival, resilience, CONSO, trying to address those communities that are prone to outbreaks. What do you do there moving forwards collectively? And then there's the other side, the more industrialized countries like Ghana and Nigeria, with all the fragmented and siloed projects, because the projects are indeed siloed. What's the next step? Where do you see either low-hanging fruits or where we should be going moving forward? Over, and this is my last question, and it applies to all of you. Thank you.
All right. I think number one critical point is enablement of the policy environment. We need to champion it. Government is expected to improve the infrastructure. Government is expected to reduce the level of insecurity. I'm taking my cassava from hinterland, and I have about 20 checkpoints within 30-kilometer radius. So these are some of the problems that goes beyond us as scientists. As scientists, the quality assurance safety level, we need to mount more awareness, training, demos to assist those investors that are already producing. I do not see any flour mill coming to Nigeria to block this kind of inclusion now, because they themselves are suffering. Nigeria needs 6 million tons of wheat every year that comes to the country. But almost more than half of that, if not 60%, are poor quality wheat. Nigerian government and African Development Bank in the last 2 years spent a lot of millions of dollars to scale up the local production of wheat in about 8 states in the north. Yet they are unable to produce more than 800,000 tons of wheat. So the government themselves know now that we need local content, no matter what percentage level. So to me, once we are able to get it, it becomes an essential opportunity for we scientists to now come up with technical backstopping with either the production level, processing level, even the master bakers level, to be able to help them to make sure that the businesses move very well together without any truncation. Thank you.
Thank you. Ben, would you mind coming in on, so you mentioned about energy, I think you mentioned the road infrastructure and so on and so forth. So how do you think you might bring that, start bringing these different ministries together? Because clearly, I mean, would you look at particular zones or areas where there may be production is concentrated there? How would you bring that policy or those different ministries who are fragmented, those different policies together around the table so that the system can be strengthened in a holistic way? Do you think it's doable?
Not in my lifetime. However, yeah, no, if I could solve the challenge of Nigerian government merry-go-round, I would be sitting in a much fancier stool. Let's put it that way. I think I would look at what one always tries to find is hotspots. Either the worst hotspots or the best hotspots, so both are possible. So I would focus my effort on where the biggest problem is, or where the most money could be made, where the most efficient area is. Those are the two levels of hotspots. And I would set up, Adrian is right. I think, a task team with all the parties involved, bring everybody together. The one person that these task teams work really well. These innovation platforms work well if they're funded, particularly they work well. They enable people, and I've seen great success in some countries around the world. So it can work. The person that's always missing from the table is the consumer. Always. Never in a task team, never at a public think tank, has no agency in any country. And I was just thinking while I was listening to people speak, how on earth do you give consumers agencies in these countries? So one of the things that we did in one of the countries I worked in is we started a journalist food safety group to try to get journalists behind this, because normally there's just no food safety. Nobody's looking after the consumer. Nobody represents the consumer. And without a consumer voice, you'll never get any balance in this whole story.
Thank you. Anyone else wants to contribute before we close?
Yeah, I think we're going to need to wrap up.
Yeah.
We're going to need to wrap up in the next minute or so.
Yeah. Anyone with any pertinent comments?
Just a quick one. I wanted to add to what Professor Sani said when he was answering your question, that we shouldn't make the mistake of trying to solve all the problems as one unit. We need to distinguish the problems that are associated with low farmer food security needs from the one of the industrial. The way to address their challenges are quite different. Okay, we need to always separate it. When we mix it together, we forget those small people, and then the food issues of those and so on will continue to be there. Okay, so we need to always separate it when we want to address it, either at policy level or not. We can never wish away the need for direct food consumption of cassava. We must always provide that food. Otherwise, no industry will work in Africa. In addition to that, we cannot also wish away that now the livestock are going to be depending heavily on cassava waste. And even they're going to be making use of full cassava as we go on, because soon there'll be less nomadic movement of cattle, and the poultry, the corn is so expensive, and they'll be looking for substitution coming from cassava to meet what is needed for corn. So that demand is also there, and also there is food quality issues that have to do with what you send to livestock, because if you give aspergillus loaded cassava chips and turn it to flour, you're going to bring cancer to the chicken. So it's also something to be watchful. So let's not just mix their issues. Anytime we want to bring solution, we need to separate the different grades. Thank you.
Thank you so much. Adrienne, did you want to quickly say something?
Just to quickly add to that, I agree with that. And I was also struck by what Ben said about focusing on the areas that are likely to make most money, or the areas that have the most problems. To go back to Conzo, I think it's quite well understood which areas are likely to have problems with Conzo. And those areas do apparently appear to be some of the poorest and most marginalized. But it's not beyond the imagination or a real possibility, if the will was there, to develop better monitoring and, in a sense, kind of early warning systems, which would allow intervention before the problem becomes serious. It's probably idealistic to expect that could also lead to a better focus on the potential for development opportunities and livelihoods development, but one can always hope. Thank you.
Thank you so much. I think that is really true. I agree 100% with that personally. That's the kind of approach that seems the most sensible to take in that kind of situation. But that monitoring, surveillance, and so on, it even applies to even the industrialized, as Ben was saying, with all the safety problems. So, I think the message is you don't get sustainable with fragmented systems. And so I think the move towards this kind of holistic approach, whether you're dealing with the Konzo communities or the industrial ones, needs to be strengthened. On that note, I'm going to hand over to Isabel and Rosalind to close. Thank you all so much for today. I know it was a bit of a hard one to talk at this hour. Thank you.
Well, thank you very much, and I appreciate that it's very late where many of you are in Africa and Europe, and the reason for that is that there are people in other parts of the world, from India to Australia through to the Pacific Islands, so it's always hard to find a time, and of course the United States. I would like to thank all the speakers in this last session that we've just had, and all the speakers that we've had over the 2 days. Thank you very much for bringing up your time for this first conference for the International Safe Cassava Network. I did think on we're talking today that, you know, there is a place for linking further with the cassava and the 21st century people, and perhaps as a special interest group in the Roots and Tubers Association, there could be something. Also, I would recommend that the Roots and Tubers people might like to get in touch with the Global Plant Council, that they may be able to help them facilitate their amplify their messages. I want to thank the Global Plant Council for hosting this, for Isabel Mendoza for organising it. And I think what with this session, these sessions over the 2 days have shown that we need to bring together all these different people to bear on the issues of cassava, particularly relating to cyanide diseases and Konzo, but also other issues as well, but focusing more on that. And we need we've had talks from plant scientists, molecular biologists, neurologists, physicians, people in nutrition, public health, economics, and systems approaches and policy approaches. And I think we need to talk to each other, but more importantly, I think we need to listen to each other so that we can progress this. And I suspect with what Richardson has said, this will be a stepwise approach, even though we may do it in a systems framework. If you want to join the network, please email Kira. If you want to support the work that we're doing, sorry, that's the wrong slide. The Konzo Prevention Fund was set up at the Australian National University in honour of Howard Bradbury as a memorial, who developed the wetting method. If you'd like to donate to that, that money will go towards making the kits, and also we have a small contribution from them to support the International Safe Cassava Network, to support a little bit of administrative support. So with that, I think, is there anything else I'm missing? These talks have been recorded and will be available shortly on the YouTube channel of the Global Plant Council. So I'm going to wrap up there unless there's anything else. Thank you for your attention, and look out for the webinars that we're having as well. Isabel, you wanted to say something?
Yes, so for what's to come, I will send in the next couple of days the links to both recordings, and I will include there any information that the speakers wish to include, all links or connection to your platforms. So just send it my way, and I will put together the message.
Great. Well, thank you, everyone. And thank you to Isabel and Kira for their organisation.
Thank you. Well
Thank
done.
you.
Bye.
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 Bye-bye.
I forgot to say thank you to all you fabulous people who are online. Many of you are still here. So thank you for coming. I'm going to go. Is that okay? Do you need me for anything, Isabel?
No, I'm gonna
Right.
close